Hello and welcome to another quick series. Today we will be going over Trichotillomania. The quick series focuses on the DSM-5 and specifically targets high-yield, relevant clinical and test material that may help you in both the clinic and the classroom. Please do not use this for self-diagnosis. So the first major diagnostic criteria of trichotillomania is going to be frequent pulling of hair, and that's going to equate to hair loss. It must equate to hair loss. So a frequent pitfall for this disorder is going to be you thinking this has to come from the head or the scalp. It does not. This can come from any region of the body. Additionally, you'll have to make continuous attempts to decrease or stop pulling your hair. This is not going to be something where you continuously enjoy and never want to stop, right? You are going to have to make attempts to stop. And this is significant because this must cause significant distress in order to meet the criteria. And that's true with almost all psychopathology. Distress could have several meanings here, right? It could be a significant impairment in the ability for you to feel confident in going to school or going out in public. Let's say you have bald patches from your disorder. Okay, that would qualify as a clinically significant form of distress. However, this could also be more internalized in the sense that you may just feel extremely anxious and upset knowing that you have this disorder and feeling like you have a loss of control. Now, this could bleed into your desire to go out to work, to school, or really any place that you would find meaningful. The last part of the DSM criteria here is going to really be more of a red flag for you to make sure that this is not caused by another medical condition and also is not caused by another mental disorder. And we'll go into the differential a little bit more coming up. So what makes this really hard to see in public or to diagnose is that many people with this disorder, especially those who are very self-aware, attempt to conceal it, right? So there are more ways to do that than you would think. So you could wear a wig, yes, but let's say the area that you pull hair from could be globally diffuse. So you could pull small strands of hair at different regions of the body and you would not be able to tell. Okay, great. So just to reiterate, this does not have to be on the head, okay? You can pull from anywhere in the body. Now, let's look at how this can be a little similar to OCD. One way to do that is to realize, just like OCD, there may be a sense of tension before the hair pulling and some relief afterwards. Additionally, people may have some form of a ritual that they must perform. This could look like taking a piece of hair and flossing it, quite literally. You could rub it between your fingers, or you could try to pull out a hair in a very strategic way where you pull from the hair root. After you do that, you will get a sense of relief. So remember, tension before, relief after. Okay, good. So let's look at the prevalence now. It is estimated that within the United States, about 1 to 2% of people suffer from this. More women than men are going to have this. As you can see, the ratio can range from 10 to 1 to more generous estimates ranging at 3 to 1. Interestingly, infants have been shown to have trichotillomania-like behaviors, okay? So some infants eat their hair as it develops. However, this typically resolves. It is important to note that this is just the case with infants. With adolescents, at the time of onset, if there isn't any treatment throughout the span of the disorder, it most likely will be chronic. Finally, it is more common if there is a comorbid OCD diagnosis. So think, if someone has a predicating OCD diagnosis and they show up playing with hair or hair loss, right? Maybe this should raise some red flags, whereas you need to eventually distinguish between normal behavior versus psychopathological behavior. Okay, so what actually defines normal behavior? Well, do not diagnose this if people are performing hair removal solely for cosmetic reasons, right? So if you're trying to improve your physical appearance or if there's something bothering you, actually bothering you, and it is cosmetic, this would not classify. Another thing is that people naturally manipulate their hair, right? This behavior does not typically qualify someone for a diagnosis of trichotillomania. Some individuals even bite their hair off. Okay, this still does not qualify for a diagnosis of this disorder. Think, is this distressing and is this wanted behavior by the individual? Let's look at stereotypic movement disorder now. So for a child who is presenting with some form of autism, with intellectual developmental disorders, something that is along the lines of that, right, on the spectrum, we'll say, it is not uncommon to see them doing stereotypic actions like head banging, biting at the arm, or, here, pulling hair, right? When this is happening, if a child with this, with stereotypic movement disorder or an adult is presenting with that, and they are pulling their hair, this would not be the primary reason for the hair pulling, right? It wouldn't be trichotillomania. So in that case, they would not meet the criteria for this disorder. And this is the same thing for psychotic disorder. If someone that is actively psychotic is pulling out their hair, this is not trichotillomania. Now, with body dysmorphic disorder, it can also present similarly to trichotillomania. The way it differentiates is that someone with body dysmorphic disorder is going to perhaps engage in hair picking, but this will not be because of a need or a compulsion to pick at their hair, right? It will be to fix a perceived fault. If you'd like some additional information on body dysmorphic disorder, it is posted above. To wrap up this video, let's cover the comorbidities of trichotillomania. So the first one is major depressive disorder, and this is common with both BDD, so body dysmorphic disorder, and OCD. However, what's new with trichotillomania is excoriation, and that is skin picking. So skin picking and hair pulling happen to coincide. Now, this isn't by accident. Okay, so when you see that someone is picking at their skin and they have trichotillomania, there is something underlying this. People with trichotillomania have some form of a somatic fascination, right? They are going to play with their body. They are going to bite their nails more. There's going to be repetitive body behaviors. That is huge. There's going to be repetitive body behaviors. So, as soon as you see trichotillomania, think, does someone have major depressive disorder? Do they have excoriation? And more importantly, is there some other body focus, repetitive body behavior? All right, so that wraps up this video. Thank you so much for watching. If you found it helpful, please consider subscribing or hitting a like so that you can have more access to videos like this.